Hello everyone, we're going to be doing our quick course overview virtually today via video, and so you may want to have in place in front of you the syllabus, the timeline, and the course competencies. And this is the screenshot just from Blackboard. Just in case I didn't mention it, the course is the principles, PTA Principles of Musculoskeletal Rehabilitation. And this is the course that follows PTA, therapeutic exercise principles, and applies those principles specifically to musculoskeletal disorders. So we'll start with the course syllabus. And this is set up like every other course syllabus that you've seen from me, and gives the course number and the CRN number on top, and then of course my contact information, and that hasn't changed. You should probably plug that phone number into your cell phone so that if you're going to be late or have a delay, you can get a hold of me. Office hours, as a reminder, have been sparsely attended lately, so my office hours are Monday and Wednesday mornings from 9 to 10. You certainly can make an appointment for another time. This course runs very much like the modalities course, so we'll be starting at 10 in the morning, and we are scheduled for 2 hours in our lecture room, room 1225, and then we have 4 hours scheduled in our lab. Of course, as you know, we kind of use that time fluidly. Sometimes we need more lecture time, sometimes we need all lab time, and I try to indicate that for you on the timeline, and of course prior to at the end of each course day I'll let you know where you should show up on the next course. Open labs Monday and Wednesday from 5 to 8, and then there's always Fridays from 10 to 2. Of course, we do have open lab on Tuesday nights. I try to reserve Tuesdays and Fridays for the checkoffs that are in the modalities course, but you of course can be self-directed in your open lab activities and practice, and in fact I encourage you to practice a mix of things on just about every night so that you kind of keep yourself up to date. So you can see you've all satisfied the prerequisites. The required textbooks, you have all of these. Your Kisner and Colby is your therapeutic exercise textbook. That's going to be pretty much your Bible for this course. We will use it extensively. Pearson will use a little bit. Muscle testing and function is always a good resource for you. And then we'll use the physical rehabilitation from O'Sullivan and Schmitz a little bit as well. The Hoppenfeld book is the green one that you used hopefully a little bit in the kinesiology course, and it's the one that's really good for palpations in particular. And then your measurement of joint motion, your Norkin and White book. In this course you will have 3 exams. They're all 100-point exams, and then they all have a lab exam associated with them. And you'll see as we go through the timeline that this course is divided up into body regions, just like the kinesiology course was. So moving on in the syllabus, you have to attain at least a 19 out of 25 on every lab exam, and you do get 3 attempts. If you would fail a lab exam, because part of that is clinical decision making, you will need to redo the one that you didn't pass to show that you've mastered that material, and then you'll need to pick a new one to show that you can do something that you didn't already know about. If you don't pass those lab exams within 3 attempts, then that would terminate you from the course and also out of the clinical. In addition, to successfully pass the course, you have to get a 75% average on the written exams. So this is the same. These procedures or policies aren't any different. I think what's a little different is there aren't any checkoffs in this course, and there aren't any assignments. So your course grade is based on your 3 written exams and your 3 lab exams. For communication, of course, I try very hard to respond to phone and email messages by the end of the next business day, and also to return your written exams by the following class session. You know, when you do a lab exam, you get that information back right away. So, and there isn't an assignment, so you don't have to worry about that. I know you know the attendance policy. I think what people forget is that if you miss a class you have to request that makeup assignment. I don't just run after you and give it to you. The purpose of the makeup assignment is to have you review information that you missed in a different format, and it makes up for the 5 points that you lose for missing the class period. So again, make sure that you call prior to class. I prefer a call to an email, so I much prefer you to call, and even if you have to leave a message on my phone, but it does give me the opportunity to call you back and communicate with you. So please call, and again, ask for that makeup assignment. As far as emails, if you do want to email me, ask questions of the review or clarify information, anything like that, make sure that you're sending it from your BTC student email account. You should also check that frequently, because that is the only way I can really communicate with you if you need to hear information outside of class. And again, that's if I send an announcement out through Blackboard, it's going to go to your school email, so you definitely need to check that. You all know the cell phone policy, and I'll just leave it at that. Enough said. And regarding academic honesty in this course, really again, you're only graded on 2 things, your written exams and your lab exams. And obviously we want you to, outside of those 2 activities, we want you to collaborate extensively with each other. However, for lab exams in particular, I think you need to really be careful not to talk about anything related to a lab exam, since people are taking that over the course of several hours. And then finally, information about support services. Definitely, if you have a documented disability, you should request the appropriate accommodations, and you do that by going through the support service staff, disability support service staff in room 2216. And if you need accommodations, you really should take advantage of that. If you need assistance with logging onto computers or your email, your password, or Blackboard, the information is there for you. And then finally, I really think some of you should take advantage of some of the tutoring assistance, particularly in reading and writing communication, study skills. I think there's a lot of information, a lot of resources available, support services here at the college. So that is it for the syllabus, and we'll go ahead and go on to the timeline. So I apologize for the tiny print. I couldn't figure out how to get this slide any bigger, but I wanted to present each unit in total. And so there are 3 units. We're going to start with a spine unit, then we'll have upper extremity, and then lower extremity. So you can see obviously each date on the left. Then the topic of the course, of the class for that day, is in the middle column, and then the column on the right gives you all the supported learning activities. So there's definitely readings there. You'll be able to see right away the initials K and C, Kisner and Colby, so you're going to be using that textbook, as I mentioned, very extensively. B and B is the Behrens and Beinart book. That's the modality book. And you'll see that you have a reading for that for the 27th for lumbar spine, and that's going to cover spinal traction, components of spinal traction. And then you'll see a video, spine biomechanics, and then again in parentheses BB. This BB refers to Blackboard. And there are going to be several videos placed on Blackboard to just help you do a quick review of the anatomy of an area prior to us doing any of the topics. And obviously in this case it's for the spine. So you really want to have those done before you come to class. It'll make class go a lot easier for you. I would also highly recommend that you dig out the flashcards from kinesiology and review muscle attachments, muscle actions. I am going to presume that you know those and you know them relatively well, and that you can apply exercises to those muscles and to those tissues. So you want to review those. I'm going to be doing another video for Introduction to Musculoskeletal Disorders, and you'll be able to see that in the video section, so you'll want to watch that. And then on the 27th, when you come to class we're going to start right with the lumbar spine and SI joint pathologies. So we'll start right with that in the lecture room. That is going to take a while. There'll be also a lot of demonstration of exercises and techniques, exercise techniques that you're going to do. So definitely come prepared to be very active in lab. We'll be going through a lot of core stabilization, core type exercises for the lumbar spine in class. So depending on however far you get on the 27th, that activity then will be picked up on the 29th. And then you'll see on the 29th there are 2 other videos, the Save Your Back program and the Back Care program by Saunders. Those are actually, they're probably videos, so I might have to look at that. They are in the bookshelf right behind the teaching station in the lab, and we don't have any video players anymore, so I'll have to see about getting those put onto DVDs for you. But either way, if you want to take a look at those, see if they are DVDs or videos, but that information is... Saunders is a really well-known and well-regarded physical therapist, and he has done a lot with back care, a lot with patient education, and helping people learn how to take care of their back. So a lot of preventive activities, a lot of posture issues. He does a lot with traction. In the modalities course, we'll see some information from him with the home traction units. He's the one that designed the home traction units that we use. So he has a lot of great information for clients and patients. On the 3rd, I will be back, and we will be going through the spine lab. So you aren't going to have time to actually work on it on the 3rd, but we will go through it all together. And then on that same day, then we are going to start cervical spine and TMJ treatment. And again, if you look in the right-hand column, you'll see that there is there are videos on cervical spine anatomy, or not anatomy, I'm sorry, the cervical spine pathology and exam and the TMJ pathology and exam. So I've included those. That was actually in a previous year, but I know some of you have said you like to be able to go back. So I still will be going through much of that information in class, but the information's there for you as well. But between the 3rd and then on to the 5th, we will be focusing on treatment activities for the cervical spine as well as the temporomandibular joint. That brings us up to the 10th. We will be doing posture. So no, you don't have to get down to your BVDs. We aren't doing the posture assessment, but we are going to focus on postural abnormalities. You were introduced to those in kinesiology, and we will be learning how to treat them in this course. And then we will also do a review activity for the exam. You can see on the 12th that we're actually going to start talking about the upper extremity. We're going to start talking about the shoulder. And then on the 17th, you have your first written and first lab exam. So what I've done is just give you a little bit of a break, because I think if we introduce posture material on the 10th, it's too quick to turn around and test you on that material on the 12th. So we'll actually intersperse the shoulder, get that second unit started, but then actually the exam will not cover the shoulder, so it'll cover everything up through the 10th. All right, well then when you come back on the 19th, and again I don't know why this font get really big and easy to read, but on the 19th we'll continue working on the shoulder then and finish up with the shoulder lab, and then we will also work on the elbow and the forearm. And you can see there's an elbow and forearm video on Blackboard. And let me go back. You'll see on the 12th, right here, there's a shoulder girdle anatomy video that'll be on Blackboard for you. The 19th, are also going to have a booth and participate in the health fair, BTC Health Fair that's held in the North Commons. And we'll be setting up a schedule, and you'll probably be in pairs or groups of 3, and we'll rotate you through maybe every half an hour, 45 minutes. So no one's going to spend 3.5 hours at the health fair. But we'll need a couple of volunteers to help set up in the morning, just help with general setup of the health fair. Then we'll have some, as I said, pairs of people. And basically what we'll do is offer flexibility assessments, because you have all done assessments of muscle length, so hamstring length, pectoralis. I have a couple of them that we've listed out, so I'll have handouts, and then pictures or examples of stretches that you can teach people to do if they find that they've got a tight muscle or two. So I've got all the information organized, and then I'll just go through it with you. But we'll just be doing that, and you'll be doing it again in groups of 2 or 3, kind of interspersed throughout the day. So no one's going to be pulled out of class for any extensive period of time. On the 24th then, we'll talk about the wrist and hand. And again, you can see in the right-hand column, there are 2 videos. One just reviews wrist and hand anatomy, and then the other one is on a treatment called mirror therapy. And that has a lot to do with treatment of chronic pain issues. And so this will tie in nicely with the modalities information about chronic pain and central sensitization that we've talked about. On the 26th then, we'll be going through just doing a whole bunch of reviews. So kind of pull together everything from the upper extremity. We'll have a clicker review so that you can be ready for the written and the lab exam for the upper extremity on May 1st. And then the last unit, we're back to our tiny font again. We start on the 3rd with the pelvis and hip. And you can see there'll be a video on Blackboard to review hip and pelvis anatomy. On the 8th, we'll do the knee. And hopefully we can get our isokinetic unit fixed so that we can use that. There is again a video on Blackboard about anatomy around the knee, and then there's also a video on Blackboard about minimally invasive knee replacement surgery that I'd like you to watch. In addition, you'll see for the readings, there's a reading on the ACL rehab, and that's a supplemental reading in Blackboard. One of the things we'll be doing with the lower extremity is also doing gait training in addition to therapeutic exercise. And so these tables, if you see here in O'Sullivan and Schmitz in different chapters, are designed to look at gait deviations. We did normal gait back in kinesiology, and we did ambulation training, not training, but ambulation in patient interventions. So now we're going to kind of blend those, and you're going to learn how to identify abnormal gait patterns, and you're going to also learn how to do gait training for people who have had a knee replacement, a hip replacement, a hip fracture, something like an ankle sprain, something like that. And we'll learn how to pick appropriate devices as well as train people in the appropriate gait patterns. So we're adding the gait training piece that you did not do last semester. And then on the 10th, ankle and foot. Again, I didn't put Blackboard after this, but it is a foot and ankle anatomy video on Blackboard. The 15th of May we'll have a review, and then the 17th, Wednesday the May 17th, will be your last written and lab exam. So I'm not sure I can emphasize enough how much material is packed into this course and how important it is, because this is a bulk of, a lot of what you see in physical therapy in many different settings, whether you're in acute care, seeing people right after surgery, if you're in home care, or if you're an outpatient, you're definitely dealing with musculoskeletal issues extensively. And this course is going to focus on the exercises to treat those, which is, of course, the bulk of what we are doing with people, as well as gait training activities. The week is busy. You've got Monday, Tuesday, Wednesday, if you're in modalities as well, going from 10 in the morning till 4 in the afternoon in class. You'll have open lab, and then again Fridays. So, I just really encourage you to start reading early, spend a lot of time on this material because it goes very fast and it's very, very packed with information. All right, and last, I just want to point out the document you have is the course outcome summary. And this is a document that we have to develop for the technical college system, and it lists all the competencies and the criteria that as a student you need to meet in order to meet each competency in each course. So I just put one example here. The first competency, these aren't in any order as far as our timeline, but that you'll identify etiology, signs and symptoms for the patient with shoulder pathologies. And so you might do this, you might show that you're competent by responding to a case study scenario. So in other words, orally or written. So when you come to do your lab exam, essentially you're getting a scenario and you have to show that you can treat it. And as you know, on the exams, you also get scenarios, and then you have to write out how you would develop exercises for that. And then your performance will be successful when you describe common pathologies, you explain the etiology, and you identify signs and symptoms. So it's learning about the problems as well as how to fix them. And so you can go through this document on your own and review all the areas that we're going to be looking at, but it mirrors very closely, of course, what we just talked about in the timeline. All right, that's all I have for you. Make sure you go through these documents and have a great time in class. Thank you.